It's 8 in the morning, and it's already a day of sweltering heat in Miami, Florida. In the Brownsville neighborhood at the Rogers Potts home, the family is starting their day. A large fan is going in the living room, and Fonta Potts, who is just waking up, comes out to sit on the couch. Markeisha Rogers, Fonta's mother, is ready to start breakfast.
You want something to eat for breakfast? What you want?
Fonta answers, but his mom doesn't understand what he's saying.
Huh? Serious?
Markeisha goes to the refrigerator to get cereal, but she's still unsure what Fonta really wants.
Okay.
Fonta points to show her what he wants.
He's supposed to be able to talk real good, say sentences.
Instead, at 8 years old, Fonta is unable to speak intelligibly.
He started saying words at the age of 5. And I didn't used to understand him until I had to listen to him more, and I'm listening to him more, then I started understanding him.
After breakfast, Markeisha assists Fonta in brushing his teeth.
When he brushes his teeth, he don't brush it good. He just brush it in his mouth, but not on his teeth.
Again, it's tough for Fonta to hold items like a toothbrush in his hand, which is why Markeisha has to take over. After brushing his teeth, Markeisha must also help Fonta find clothes and get dressed.
Lift your hands up.
Fonta depends on his mom to get his PJs off.
Come here.
He needs assistance putting on his shorts, as well as his shirt. Markeisha then puts his socks and his shoes on his feet.
Tight. He has fine motor skills problems with his hands, his holding things.
Fonta tries to tie his shoes, but it's difficult for him to move his fingers to complete the task.
He has a hard time gripping with his fingers.
Which is why Markeisha has to tie his shoes for him.
He's supposed to do all that, yet I still had to do it for him.
It's a lot of work for Markeisha, because she also must care for her 1-year-old daughter, Naomi, as well as her 4-year-old daughter, Markeisha.
I have a 4-year-old and a 1-year-old, and Fonta is 8-year-old, and I had to do things that I had to do for my 1-year-old and my 4-year-old that I had to do for him too.
This includes brushing Fonta's hair.
I brushed his hair for him. He ain't brushed it too good.
For fun, Fonta likes video games. Yet it's unclear if he understands the game or really even knows how to play it.
Wow,
Not only is his speech difficult to understand, but he also hits random buttons on the controller.
Okay, come on.
Markeisha tries to engage Fonta to be with his family in the living room.
Stop! She didn't even do nothing to you.
But Fonta gets angry and lashes out.
His sister come in the room and try to play with him. He won't play with her, hit her and everything.
Markeisha struggles to get Fonta to do anything she asks him to do because Fonta will have a temper tantrum. And yet Fonta shouldn't be like this and wouldn't be like this if it wasn't for the lack of oxygen to his brain during labor, which could have been prevented. It was August 17, 2009. Markeisha Rogers was about 39 weeks into her pregnancy with baby Fonta. Markeisha presented for induction of labor secondary to elevated blood pressures and headaches, consistent with preeclampsia.
My head was banging and my neck was hurting. I was in pain.
Markeisha was admitted at 8:40 p.m. at North Shore Medical Center in Miami, Florida, by her obstetrician, Dr. Ada Atago, MD. Nurse Temiwayua Akinyeme, RN, was assigned to be Markeisha's nurse. At 9:15 p.m., an external fetal heart monitor was applied, and Nurse Akinyeme documented that baby Fonta's heart rate baseline was 125 beats per minute with minimal variability. Nurse Akinyeme also identified Markeisha's hypertensive blood pressure, which posed an increased risk of injury to both Markeisha and baby Fonta. Yet there is no evidence that Nurse Akinyeme ever informed Dr. Atago. At 11:39 p.m., Dr. Atago orders Servidol, which is used to induce labor. Nurse Akinyeme administered it, even though this is a direct violation of North Shore Medical Center's policy for administration of Servidol, because no Bishop score had been assessed, and there was no determination made by Dr. Atago that Markeisha had a medical or obstetrical need for labor induction. This is a breach of the standard of care by Dr. Atago. Throughout the night of August 17th and into the morning of August 18th, Markeisha's blood pressures remained in a hypertensive level, and Fonta's fetal heart rate monitor showed minimal variability with late and variable decelerations. And yet Nurse Akinyeme never contacts Dr. Atago about any of this. Furthermore, Nurse Akinyeme did not follow North Shore Medical Center's policy of nursing management of the patient with preeclampsia-eclampsia. The policy states nurses must notify a physician for the following: maternal pulse greater than 120 beats per minute, and non-reassuring fetal heart rate or changes in uterine activity. Starting at around 1:30 a.m. on August 18th, Nurse Akinyeme begins to document coupling contractions with minimal variability, before Pitocin was even provided. Nurse Akinyeme never informs Dr. Atago, even though patients who develop coupling of contractions have a risk of longer duration of labor, as well as an increased incident of cesarean section for failure to progress. At about 5 a.m., Marquisha's membranes had spontaneously ruptured with clear fluid. About 90 minutes later, Marquisha developed an elevated heart rate. Her blood pressure remained elevated, and Fonta's fetal heart rate tracing showed minimal variability with late and variable decelerations until 8:30 a.m. A new nurse on duty, Nurse Gary Pant, RN, called Dr. Atago and gave him a report. In response, Dr. Atago ordered Pitocin. At about 9:15 a.m., Pitocin was started, and the fetal heart rate monitor showed minimal variability with late decelerations, which means baby Fonta was not responding well because he was not getting the adequate oxygen he needed. At or about 9:30 a.m., Pitocin was increased, and Nurse Pant charted minimal variability with no accelerations or decelerations. However, expert nurses and physicians who reviewed the fetal monitor strip have identified absent variability and late decelerations at that time, which is indicative that Fonta was still not receiving adequate oxygen. This is a direct violation of the North Shore Medical Center's oxytocin or Pitocin policy, which states oxytocin should be discontinued for the following: Category 2 or Category 3 fetal heart rate response. At 11:15 a.m., Dr. Atago is in the room. Yet Dr. Atago fails to recognize the situation, and instead of stopping the Pitocin and getting baby Fonta out, he has Nurse Pant increase the Pitocin. Nurse Pant continues to document recurrent late decelerations into the afternoon and early evening. At 6:42 p.m., Nurse Pant leaves, and the report was given to Nurse Kim Florinord, RN. At 7 p.m., Nurse Florinord turns the Pitocin up to 20 mu. Fonta's fetal heart rate tracings continue to show minimal variability and late decelerations. After strong, long, and frequent contractions on August 18, 2009 at around 8:20 p.m., baby Fonta Potts Jr. was delivered. His breathing was slow and irregular, and he was minimally active and floppy.
The Fonta came out pale, looking like he was dead, like floppy, pale looking.
Pediatric neurologist Dr. Stephen Glass, MD, notes that Fonta experienced blood loss, and this, along with the direct effect of trauma, more probably than not, then resulted in a hypoxic ischemic injury to this infant's brain. And Dr. Glass believes this injury occurred during labor. According to physical medicine and rehabilitation specialist Dr. Paul Kornberg, MD, Fonta's brain images demonstrate that he suffered a lack of oxygen to his brain.
The findings on Fonta's imaging studies are consistent with a hypoxic ischemic brain injury. There were abnormalities seen on some of the scans in the parietal lobes on both sides of the brain and both frontal lobes. There was also damage to the deep structures of the brain, the thalamus.
Fonta's brain injury has affected him in many areas of his life, including deficits with fine motor skills.
He grasps a pencil or a pen in a very awkward manner.
You gotta try to hold a pencil like this.
Requiring more assistance than another child his age would otherwise need.
Fonta's life care plan outlines a lifetime need of occupational therapy, which will address his fine motor skills deficit.
Occupational therapy has been recommended to continue to try to improve his abilities. His dexterity, his manual ability to manipulate objects has been affected and is going to continue to be a problem for him over the rest of his life.
Fonta also struggles to focus on specific tasks.
Okay, wait, you ain't finished yet? Come here.
After just a couple of minutes of writing, Fonta is ready to move on to something else.
If you meet Fonta, he's very hyperactive, he's very distractible, but this relates to his brain injury. That was the cause of this. He manifests the symptoms of ADD or ADHD because of the severe brain injury.
Fonta's brain injury has also affected his behavior. And he frequently has temper tantrums when his mom tries to get him to do something.
Calm down. Calm down.
It's a struggle for Marquisha into the evening, especially when she tries to get Fonta to focus to take a bath. He gets upset and refuses to wash himself.
One of the other severe effects of Fonte's brain injury is how it's affected his behavior. Fonte has trouble with impulse control, with aggression,
Well, get out the way like that.
with concentration and attention.
Come on. Show me how you take a bath. Come on. Take a bath. Fonte.
Because Fonte refuses, Markeisha has to wash him. Markeisha must also towel Fonte off and get him out of the tub. She then must find his PJs and help him get dressed.
So I would expect a child with this type of brain injury to have problems with impulse control and aggression and behavior, and I think these are going to be issues that are really paramount to planning for his future needs.
Which is why the Life Care Plan showcases the medications to address Fonte's inattention and distractibility. It also addresses his behavioral needs.
The reason we recommend those types of things is going to be to help him to have the best quality of life possible.
Before bed, Markeisha works with Fonte on reading and saying words.
Let's
No.
have, have, have
Has been
a
a day
picnic.
been
Fonte has a great difficulty with language, with both expressing himself and also with understanding.
All of which is due to Fonte's brain injury.
In the left temporal area, which is an area of the brain that's very important for language, which is an area that's severely affected for Fonte.
And because of this, Dr. Kornberg believes Fonte will need speech therapy as well as other items to assist him with speaking. Fonte's Life Care Plan provides him not only with communication devices, but also private speech therapy sessions.
With Fonte's severe deficits, I believe that he really requires services outside of the school to complement the school teaching and school therapy services.
Dr. Kornberg believes Fonte will also benefit from private school as well as a tutor.
Because of his brain injury, I expect him to have a greater and greater difficulty learning. I don't expect him to be able to earn a regular high school degree.
Experts say Fonte will not be employable as an adult in the competitive job market, and he will require assistance with instrumental activities of daily living, such as managing a home, his finances, and to ensure his safety.
Good night.
Markeisha puts Fonte to bed, and she has to supervise him because he has trouble sleeping.
He stays up. It ain't just going to sleep when I tell him to go to sleep.
I expect he's going to require 24-hour, 7-day-a-week supervision and assistance, both now and for the rest of his life.
I'm too big to slide.
Markeisha cares for Fonte now, but worries about the future.
As Fonte continues to get older and bigger and stronger, his impulse control issues and behavioral issues will make him an even greater risk for harming himself or others. So appropriate supervision is going to be a critical factor.
And what's so difficult for Markeisha is knowing that life didn't have to be this way for Fonte.
We could have been fine. Just sad. I don't have to go through this. I'm hurt. I love my son.